Today, we have a patient who presents with headache. My name is Norman. How may I help you today?
I have a splitting headache.
When did it start and how did it start?
It started 2 days ago and it started gradually.
Describe the pain for me.
It's a throbbing pain on the left side of my head, which becomes worse with activities.
Did you have any nausea or vomiting? And does the light makes the headache worse?
Yes, I had nausea and vomiting, and the light causes eye pain and also worsens the headache.
Did you take anything for the headache?
I did not take any medication, but I did relax in a quiet dark room, and it seemed to have helped.
Did you have any weakness, blurred vision, confusion, or change in your speech? And have you had this headache before?
I had no weakness in my legs or hands, no blood vision, no confusion, and no slurred speech. Yes, I have had this same headache before at least 4 times.
Your physical examination was good. There were no cranial nerve abnormalities, no dysarthria, no dysphagia, no double vision, no ataxia, no dizziness, no defects in visual acuity, good pupillary response, no scalp tenderness, and no facial tenderness.
That's good to know. But what are you giving me for this headache? Do I need a head CT?
No, you do not need a head CT. However, I am giving you a class of medication known as ergot. The most common is the dihydroergotamine. This class of medication interacts with serotonin receptors. Another medication I could give you is sumatriptan. Either of these medications can be given with an antiemetic.
Okay.
I will give the sumatriptan because I can discharge you with it. Dihydroergotamine has to be given by intravenous route, and I can't discharge you with it. Sumatriptan has to be given cautiously to patients who have hypertension. You have migraine headache. It is divided into migraine with aura and migraine without aura. You have migraine without aura. There is gradual onset of unilateral throbbing headache with associated nausea, vomiting, and photophobia. It improves in a dark, quiet room. This is a vascular headache most likely caused by vasodilation. Caution should be taken when sumatriptan is given to patients with hypertension.
How do you actually diagnose migraine headache?
For migraine without aura, at least 5 headache attacks lasting 4 to 72 hours, whether untreated or unsuccessfully treated, which have at least two of the following characteristics. Number one, there should be unilateral location. Number two, there should be a pulsating quality. Number three, there's moderate or severe intensity of the headache, which inhibits or prohibits daily activities. And number four, The headache should be aggravated by walking, climbing the stairs, or similar routine physical activity. In addition, during the headache, at least one of the following symptoms should occur. Number one, phonophobia and photophobia, and also nausea and or vomiting. In addition to what was previously said, here are some things to remember. Number one, migraine is the second most common primary headache, affecting 12% of the United States population. Number two, on the physical exam, there should be no neurologic deficits. And number three, if the headache starts suddenly and reaches a peak in seconds to minutes, consider an alternate diagnosis. Well, study hard, and I wish you well.